5 promising oils for nerve regeneration. Welcome to our video. Did you know that the pain, numbness, or discomfort from nerve damage can be alleviated with natural at-home solutions? Today we'll reel 5 of the best natural oils to support nerve regeneration, effectively reducing pain and inflammation. Don't miss out. This information could transform your nerve health care forever. 1. Peppermint oil. Menthol, the primary active compound in peppermint oil. Benefits: natural analgesic. Menthol works by blocking pain signals from the nerves to the brain. Cooling sensation, provides a soothing effect upon application to the skin, alleviating pain and discomfort. Anti-inflammatory properties, reduces swelling and inflammation in affected areas. The menthol and peppermint oil stimulates cold-sensitive receptors on the skin, providing soothing relief and pain reduction. Simultaneously, it enhances blood circulation, promoting nutrient and oxygen delivery to the affected nerve area. Furthermore, peppermint oil possesses antibacterial and antioxidant properties, safeguarding the nerves from further damage caused by inflammation or free radicals. Pain and numbness relief, effectively soothes nerve pain and related symptoms, such as numbness and burning sensations. Supports recovery, improves blood circulation, accelerating nerve regeneration. Promotes mental well-being. The refreshing scent of peppermint uplifts the spirit and reduces stress, factors that can exacerbate nerve pain symptoms. 2. Lavender oil. Linalool and linalool acetate, the primary constituents of lavender oil, offer a range of therapeutic benefits. These compounds demonstrate analgesic properties, effectively alleviating nerve pain. Their anti-inflammatory action helps reduce swelling in affected nerve areas. Furthermore, their sedative effects promote relaxation, easing tension and anxiety. Neurological effects. Linalool modulates neurotransmitters, reducing pain signals and improving mood. Lavender oil's relaxing properties alleviate stress and promote sleep, crucial factors in mitigating nerve damage symptoms. Anti-inflammatory action. The oil soothes inflammation, lessening pressure on nerves to reduce pain and support tissue regeneration, relieve pain and nerve tension. Effectively soothes both chronic and acute nerve-related pain. Particularly beneficial for individuals experiencing nerve pain accompanied by stress and anxiety. Improves sleep quality, promotes easier sleep, mitigating the negative impact of sleep deprivation on nerve recovery. Support overall relaxation, fosters a sense of well-being, reduces mental stress, and supports faster nervous system recovery. On-site massage. Dilute lavender essential oil with a carrier oil, such as coconut or jojoba oil, at a ratio of 2-3 drops of lavender oil to 1 tablespoon of carrier oil. Gently massage onto the affected area to alleviate pain and promote circulation. Relaxing bath. Add 5 to 10 drops of lavender essential oil to a warm bath. This will help relax the body, relieve pain, and improve sleep. Aromatherapy. Use a diffuser or place a few drops of lavender oil on a tissue for deep inhalation. This method helps reduce stress, improve sleep, and promotes overall relaxation. For optimal use, dilute before application. Undiluted essential oil may cause skin irritation. Avoid direct application to open wounds. The oil may cause discomfort or irritation. Perform a patch test. Apply a small amount to a discrete area of skin to check for allergic reactions. Pregnant women and young children, consult your physician before use, as lavender oil may not be suitable in all cases. 3. Chamomile oil. Chamomile essential oil contains 2 key compounds, chamazoline and alpha-bisabolol, offering a range of therapeutic benefits for nerve health. These compounds demonstrate potent anti-inflammatory and analgesic properties, effectively reducing swelling, inflammation, and nerve pain. Furthermore, their sedative effects promote relaxation and support nerve regeneration. The oil also boasts flavonoids and terpenoids, which act as antioxidants, protecting nerve cells from free radical damage and further injury. This synergistic combination of beneficial compounds offers a promising approach to nerve health and well-being. Anti-inflammatory effects. Chamomile oil inhibits inflammatory enzymes, thereby reducing nerve pressure and pain. Nerve regeneration. The compounds within chamomile oil support the repair of damaged tissue and stimulate nerve cell regeneration. Soothing effects. Its gentle aroma and effects on the nervous system help reduce stress and anxiety, factors that can exacerbate nerve damage symptoms. Neurological pain relief. Chamazoline and alpha-bisabolol offer natural pain relief, particularly for chronic pain. Anti-inflammatory action reduces inflammation in affected nerve areas, improving swelling and pressure on nerves. Relaxation support promotes relaxation, improves sleep, and fosters an optimal environment for recovery. On-site massage. Dilute chamomile essential oil with a carrier oil, such as almond or coconut oil, at a ratio of 3 to 5 drops of chamomile oil to 1 tablespoon of carrier oil. Gently massage the affected area to promote absorption and alleviate localized pain and inflammation. Relaxing bath. Add 8 to 10 drops of chamomile essential oil to a warm bath. Immersing yourself in the fragrant water promotes muscle relaxation, reduces inflammation, and fosters a sense of well-being. Aromatherapy. Utilize a diffuser or place a few drops of oil on a tissue for deep inhalation. This practice encourages nervous system relaxation and stress reduction. Dilute before use. Undiluted essential oil may cause skin irritation if not properly diluted. Avoid use on open wounds. The oil may cause irritation or discomfort. Perform a patch test. Test on a small area of skin before widespread application to ensure no allergic reaction occurs. Pregnant women. Chamomile oil may affect hormones. Consult your physician before use. 4. Rosemary oil. Rosemary oil's key components, rosmarinic acid and carnosic acid, offer significant anti-inflammatory and antioxidant benefits, reducing inflammation and protecting nerve cells from free radical damage. Cineol and camphor further enhance circulation and alleviate pain, promoting nerve regeneration. These combined neuroprotective properties contribute to the overall healing and restoration of nerve cells. Improved circulation. Rosemary oil enhances blood flow, delivering vital nutrients and oxygen to damaged nerves, thereby accelerating the recovery process. Reduced inflammation and pain. Rosmarinic acid and carnosic acid possess anti-inflammatory properties, easing pressure on nerves and mitigating pain. Neuroprotective effects. The antioxidant compounds within rosemary oil safeguard nerves from oxidative stress damage. Pain and inflammation relief, effective in reducing nerve pain stemming from inflammation or compression. Improved circulation, increases blood flow to the affected nerve area, promoting faster recovery. Nerve protection and regeneration. Neuroprotective effects support tissue regeneration and minimize further damage. Stress reduction. The aromatic scent of rosemary oil also helps alleviate stress and improve mood. On-site massage. Dilute rosemary essential oil with a carrier oil, such as coconut or almond oil, at a ratio of 2 to 3 drops of rosemary oil to 1 teaspoon of carrier oil. Gently massage the affected area to alleviate pain and improve circulation. Relaxing bath. Add 5 to 7 drops of rosemary essential oil to a warm bath and soak to relax muscles and reduce inflammation. Aromatherapy. Use a diffuser or place a few drops of oil on a tissue for deep inhalation to relieve stress and uplift your mood. Always dilute before use. Undiluted essential oil may cause skin irritation. Avoid overuse. The strong aroma of rosemary oil may be overpowering if used excessively. Not for pregnant women. Rosemary oil may stimulate uterine contractions and is not safe during pregnancy. Perform a patch test. Apply a small amount to a test area before widespread use to check for any allergic reactions. 5. Helichrysum oil. Italidones, the key active compounds in helichrysum oil, offer remarkable cell regenerative properties, stimulating the repair of damaged nerves. Their anti-inflammatory action reduces swelling and pain in affected areas. Neural acetate further soothes nerves and diminishes inflammation. In addition, the oil's antioxidant compounds protect nerves from free radical damage, preventing further injury and promoting overall nerve health. Promoting nerve regeneration. Italidones and other compounds support the repair of damaged nerve tissue by stimulating the production of new cells. Reducing inflammation and pain. Helichrysum diminishes the activity of inflammatory enzymes, thereby reducing pressure on nerves and soothing pain. Protecting nerves. Antioxidant properties help shield nerves from further damage caused by oxidative stress, nerve regeneration and repair. Helichrysum oil is particularly effective in supporting the regeneration of long-standing nerve tissue damage. Reducing inflammation and chronic pain. It is highly beneficial for individuals experiencing persistent nerve pain or chronic inflammation. Nervous system relaxation. It alleviates nervous tension, facilitating the nervous system's natural healing process. Enhanced blood circulation. It improves circulation to the affected nerve area, accelerating the recovery process. On-site massage. Dilute helichrysum essential oil with a carrier oil, such as grapeseed or coconut oil, at a ratio of 2 to 3 drops of helichrysum to 1 teaspoon of carrier oil. Gently massage the affected area to alleviate pain and promote healing. Relaxing bath. Add 5 to 7 drops of the diluted oil to a warm bath and soak to relieve pain and promote overall relaxation. Aromatherapy. Use a diffuser to inhale the soothing aroma, which helps to relax the mind and reduce stress. Warm compress. Mix the diluted helichrysum oil with a carrier oil, then apply to a warm compress and place on the affected area. Always dilute before use. This potent oil may irritate skin if applied directly. Perform a patch test. Apply a small amount to a discrete area of skin to check for allergic reactions before widespread use. Not for pregnant women or children. Consult your physician before use, especially for sensitive individuals. Avoid overuse. Due to its potency, helichrysum oil should be used sparingly and as directed. We have explored 5 excellent oils that support nerve damage. Have you tried any of these, or do you have other tips to share? Please leave your comments below. Don't forget to like and subscribe to the channel to stay updated on valuable health information. Thank you for watching, and we look forward to seeing you in the next video with more helpful health tips.